My name is Dr. Michael Cavanaugh. I'm here to discuss the interpretation of the microbial test. First thing we look at in the top section is the animal and hospital information, which is standard on most lab reports. As we go down the report, the next thing we see is the bacteria pathogens that we possibly see and the fungal pathogens that we possibly see in the sample that was submitted. These are the most abundant that were identified in the sample. Next to it is an absolute abundance, or how much bacteria was actually identified through the sequencing, and the percentage of bacteria within the bacterial components. When we do a skin or we do a sample that we have normal values for, you'll see your normal values on the far right. In the report, when you get it electronically, the bacteria are highlighted, and these are clickable links to search engine searches for these different bacteria and can give you information on these different bacteria. Below it are the fungal pathogens. These are the different funguses that are identified, and just like the bacteria, it gives you an absolute number next to it. In the left column, in the middle column, it gives you a percentage of funguses that were identified, and then in the right would be a relative healthy dog there. On the bottom of the page, you see analysis of total abundance, bacteria versus fungal. This ring is quite helpful, and what it does is that within your sample, it tells you what percentage of the sample was bacterial and what percentage of the sample was fungal. The second page lists the different antibiotics and the pathogens horizontally across the top and tells you what genetic resistance or sensitivities there are within each one of these bacteria. Pseudomonas is our number one pathogen at 79%, and they did not determine oxacillin as a genetic resistance, but they did on the sulfonamides and the neomycins and gentamicins. There is some intrinsic resistance in these with clindamycin and the cephalosporins. And the same follows for all the other bacteria seen in this sample. On the bottom is a little key to tell you what each one of these letters mean. So if there's any questions, you can always refer to the key at the bottom. Those are primarily the first two pages I look at in detail. The following pages are extra information that can be useful in your sample. For instance, on this page, the first thing you see is a clinically healthy range for dog skin, and then where your sample falls. In this case, this sample is outside the normal reference range, so we consider that a pathogenic sample. These are some other microbes of interest and their abundance in the sample, both bacterial and fungal. This page here consists of the bacterial analysis of your sample. On the right is a normal dog and the bacterial diversity that's on the skin. On the left is the sample here that we collected. And as you can see, this blue area, it's 80% of the sample, and that's the Pseudomonas. And then we repeat our bacterial pathogens that were detected from the most abundant to the least abundant. Again, you can click on these bacterial links and find Google results. The following page is exactly the same as the first one, except it's not bacterial, it's a fungal analysis. And as you see in the ring on the right, that's our clinically healthy range. And the one on the left is the sample we collected. And as you can see, they're pretty close to the same. The funguses that were found are listed here and with their relative abundances. The last page is the methods and some references. If you have any questions, feel free to call MiDOG at 833-456-4364 or visit us on the web.